As a periodontist, of course, we started out trying to save every tooth, but you're going to lose teeth throughout your life for one reason or another. If the tooth has to be removed, there's three basic options. One's to do nothing, which is the worst option because your teeth will drift over time. Second thing you can do is a fixed bridge. A fixed bridge is the traditional way to replace a single missing tooth in dentistry. The problem is you usually have to sacrifice a lot of tooth structure on either end because it's like a bridge. You have to go from one tooth to another tooth with a fake tooth in the middle, but those two teeth, the abutments that hold it up, have to be cut down dramatically to fit crowns over. Third, what I think is the best option today is dental implants. A dental implant is simply a titanium alloy screw that we drill a hole and place it in the jawbone. The first thing we do is take a 3D or cone beam image of the jaw. This allows us to see the quality of bone. Once we've completed that, I like to send it off to a laboratory and they make what we call a surgical guide, which allows me to place it in the patient's mouth and it guides the drill. So there's no guesswork to it at all. It's all precision. 1, 2, 3, put the implant in and that's it. It works the best. We do most of our surgery utilizing IV sedation so the patient's totally comfortable, doesn't remember anything, and it works out well.